All of you, very good evening. I hope I am clearly audible and visible. Clearly audible and visible. Okay. So those who are new to the platform, Unacademy is the largest learning platform which provides you online live classes at the comfort of your home. So to get any Unacademy Plus subscription, you need to subscribe yourself to attend the Plus live classes. And the benefits of the subscription will be you will get live classes of all 19 subjects for your exams. The courses are prior structured long time before, and for the duration of subscription, a subscriber will have unlimited access to the courses for the duration of your subscription. And this is how the subscription page looks like. So depending on your need, you can select the duration of your subscription, like 1 month, 3 months, 6 months, or 12 months. And at the time of checkout, you can apply this referral code to get a discount. So let us start with the session. Today the session is based on clinical toxicology, so you will get across many new questions. Let us start with the question number 1. All of you put your answers in the live chat window. Good evening, Girish. Good evening. These questions will increase your thought process. So giving you 1 minute for every question. I will give you 1 minute because the questions are lengthy, options are lengthy. So I have started getting answers. Very good. Very good. Perfect. More people. All of you try to put your answers. Okay. So yes, those who have answered, they are totally correct. The correct answer will be B option. So what are the important take-home messages in this question? The take-home message is, what is benzoyl-ergonin? You should always know that this is one of the metabolites of cocaine metabolism. So when cocaine is metabolized in the body, this inactive metabolite, this is an inactive metabolite called benzoyl-ergonin. This is formed in our body. Now what is the question? A 23-week-old gestational age fetus died in uterus. So this is a case of intrauterine death of the fetus. The question is, what is the implication of detecting benzoyl-ergonin in fetal meconium? So that means cocaine was present in the blood of the fetus and then it was metabolized. So that means fetus was alive at the time of maternal cocaine use. That is the best answer. The fetus, if it was already dead, how will the metabolism take place? So that's why C is the wrong option. And yes, we can make a conclusion. So D is also a wrong option. And there is no need of additional toxicological analysis. Why? because you should know some more information. This cocaine can pass your placenta, can pass through placenta, but this metabolite benzoyl-ergonin, it is not able to cross placenta. So that means cocaine was transferred to fetal blood and then it was metabolized inside the fetus. That means fetus was alive. That is why B option is the correct option. Okay. Now another question. In a case of acute cocaine poisoning, suppose, has come to casualty and you are the attending doctor, what samples you will preserve to detect cocaine? So you can preserve samples like blood of the patient. Then in acute cocaine poisoning also, you can preserve skin, hair sample. You can put some hair samples, and what will be detected in these samples is cocaine and its metabolite, benzoyl-ergonin. So this is a very important thing to remember, that these metabolites can be detected in acute cocaine poisoning also. Okay. What we study in arsenic poisoning? Arsenic has a tendency to deposit in different parts of the body in chronic cases. This is a very important difference between cocaine and arsenic poisoning. Here you can preserve body samples where cocaine can be detected in acute poisoning events too. Both these things, cocaine and its metabolite. And this is an inactive metabolite. Always remember, benzoyl-ergonin is an inactive metabolite. Correct? Now come to second question. Okay, which test you will do to detect cocaine? What are the names of the diagnostic tests? We can use gold chloride test. Remember the names of the test. Then we can use Scott test. Scott test. So these are two named tests. So what happens if I use gold chloride reagent in the sample where cocaine is present? I will get crystals like this. A central filament will be there through which will be attached perpendicular plates like this. And these plates will be golden yellow in color. Everything will be golden yellow in color. So what is these crystals called as? They are crystals of cocaine hydrochloride. When the sample is mixed with, sample having cocaine is mixed with this gold chloride, what happens is we get cocaine hydrochloride crystals which appear under microscope like this. A central filament with perpendicular plates attached to it. Next one. Read the question carefully. This one is altogether a new question for you all. Giving you full 2 minutes to put your answers. This is 1. He collapses 1 hour later. Think. All these questions are one step ahead questions. Your upcoming questions will be like this. So I think many people have tried. Now let me tell you the correct answer. See, what is the question? A 35-year-old man with a known history of drug abuse. So this is clearly given in the question. History of drug abuse. This is how you should approach a question. Now what he was doing was, he was acting crazy, means there was altered perception in his behavior, and he was doing somersaults in the nude. He was totally nude and he was doing somersaults in public, and he was talking unintelligibly. So all this is telling us that his CNS system is compromised. This much information is given in the first line. Now he collapses 1 hour later and cannot be resuscitated, means death of the patient occurred. Very quick death occurred. The family reports that there is no known medical conditions. Autopsy shows no obvious injuries or disease processes. Standard comprehensive toxicological analysis is negative. Now what do you mean by toxicological analysis in a poisoning case? We will preserve all the samples, all your viscera samples, okay, then your blood sample and urine sample. All this give negative results. One option can be easily ruled out. Now what is the need of doing toxicological screening of gastric content? When you have already done the toxicological analysis, in our visceral preservation, you all must have read, we preserve all the organs involved in absorption of a poison, metabolism of a poison, and excretion of a poison, like stomach, intestine, liver, kidneys. All these organs are already preserved. They give negative results. So that's why D option can be easy. Now this question is not going towards, there is no medical history of diabetes or something like that. So vitreous glucose and ketones can be easily ruled out. Okay, this C option can be easily ruled out. Now the question is between A and B, which one to pick. Now is there any sign of heavy metal poisoning? This is basically CNS system involvement. So always the best answer of choice will be option A. So what you need to do now is directed analysis for synthetic cannabinoids. Now what are synthetic cannabinoids? Natural ones you know, bhang, charas and ganja. And the ganja product, when it is smoked, it is called marijuana, marizones. So synthetic cannabinoids comes in market as synthetic marijuana. What are the common names of synthetic marijuana? It is also called as K2. It is also called as spice. So now you need to look for whether synthetic cannabinoids have been taken by the patient or not, because the patient died instantly within about 1 hour. Got it? So additional testing should be towards identification of synthetic cannabinoids, which are commonly called as, these are also called as designer drugs. Basically synthetic cannabinoids, what is the origin? Their use was initiated in 2002 in the form of designer drugs. So they were designed to study the brain system of cannabinoid receptors, but they are being misused also. Okay, so they basically belong to a category of designer drugs, and use of these designer drugs to study the brain cannabinoid receptors was started in 2002, and since 2002 people are misusing synthetic marijuana or synthetic cannabinoids. So altogether a new topic for you all. Next question. Now hints are given in the question, and this one is pretty simple question. Good evening to all of you. Good evening to all of you. Good evening, Rahul. This one is simple one. Mahesh is asking one question. No, see, paracetamol has a specific toxicity towards your liver. So get your LFTs done first of all. Then get the gastric lavage done and send the gastric lavage sample for analysis. Okay, Mahesh? Now this one is a simple question. And the hint is given in the lines of the question itself. So I have given you ample time. Now let me come to the answer. A 39-year-old woman is struck by car. She had perforated nasal septum. This is one hint given in the question. So if I ask you, if you have to pick one option based on, suppose the question ends here, what you will pick as the answer of choice? Which poison leads to perforated nasal septum when it is taken through snorting route or inhalational route? The poison which will lead to vasoconstriction. So which is the only local anesthetic which is vasoconstrictor? Answer is cocaine. So based on the first line of the question, the answer goes with cocaine. Now based on internal findings, this was given to confuse you. What drug did she most likely abuse? So the answer comes from the first line itself. Now in the lungs, what we can see is deposition of black pigment, carbon pigment, giving rise to, this is how your anthracotic lungs look like. This is called anthracosis, deposition of carbon pigment in your lungs. So see, deposition of carbon pigments can occur in nicotine also, in all other options also. But the best answer of choice you have to pick out of these, no. So best answer of choice based on perforated nasal septum with deposition of carbon pigment goes towards cocaine poisoning. Only local anesthetic which is vasoconstrictor. Now what are the different routes of cocaine intake? Let us quickly revise. Cocaine can be taken through snorting route. Snorting means inhalational route. So it can cause perforation of nasal septum. Perforated nasal septum. Other way around, this question can be asked, in which poisoning we specifically preserve nasal swabs? Answer again goes with cocaine. Nasal swabs are preserved in a case of cocaine poisoning. Then it can be taken through smoking route. That was the case in this female. She used to take the cocaine through snorting route also and smoking route also. So smoking form of cocaine is called as crack. And this is how your crack lung looks like. And crack is the most toxic form of cocaine. Smoking form is most toxic form of cocaine. Okay. Now it can be taken through IV route also, intravenous route also. So cocaine can be taken through intravenous route also. And cocaine is usually mixed with heroin. And what is this combination called? IV cocaine plus heroin is your all-time repeat question of different exams. This is called, yes, speedball. So remember the routes of intake of cocaine: snorting, smoking and IV route. Smoking form is most toxic. Got your answer? So best answer of choice will be cocaine. Next one. Take your time to read the question. This one is lollipop question. After some googlies, you need to be served a simple question. Maximum answers were given in this question. So yes, this is a clear-cut case of lead toxicity. Now I will ask you certain important questions from this aspect. What is that complication which usually occurs in children due to lead? What is the name of that finding which usually is associated with children age group, and it is fatal in maximum children, 80 to 90% children? What is that condition called? A condition of lead toxicity mainly seen in children, and it is fatal in 80 to 90% of the cases. Yes, very good, perfect. Lead encephalopathy. Now in your AIMS exam, this same question was asked other way around. A 2-year-old child is in the habit of licking soft toys. Which poisoning you will suspect? So always remember, lead is an active constituent of paints, then your batteries also. Battery making industries. Recently asked in JIPMER exam. A person is working in a battery making industry and he is presenting with anemic picture. Which poisoning you will suspect? Always go with lead poisoning. Okay. Then you all know why anemia occurs, because lead inhibits heme synthesis enzymes. So heme synthesis is deranged. So obviously anemic picture will be there on. Then it can cause sideroblastic anemia also due to formation of your ringed sideroblasts. So what was the question here? The person was presenting with microcytic hypochromic anemia, then radio opaque densities at metaphyseal place. Yes, lead can get deposited at metaphyseal centers, growing centers, and lead is a radio opaque metal, so it can be seen as radio opacity in your metaphyseal plate area. So that is why the best answer of choice will be lead toxicity. Correct. Okay, got it? Now answer this one. Again, simple one. The way of presenting the question is different. So this is what will happen in your upcoming exams on 20th of November. The same thing will be presented in different manner. So never feel the pain that what will happen, what will not happen. Nothing will happen. If you know Wilson's disease, any question from Wilson's disease, you will answer it correctly. You should know the fact about diseases, their pathologies, their pharmacological things. Okay. And keep on revising to avoid any silly mistakes. So polarization of sampled kidneys in a decomposing, everything is given. Calcium oxalate crystals are there. So you should remember calcium oxalate crystals can be formed in oxalic acid poisoning and in another poisoning where the metabolite is oxalic acid itself. So that poison is ethylene glycol. So it is metabolized initially to glycol aldehyde, then it is metabolized to glycolic acid, and final metabolic product is oxalic acid itself. So yes, this oxalic acid will combine with calcium of our body to form calcium oxalate crystals, and it can give, the question can be presented like this also. The person was having paresthesias over different parts of the body and tetany features. So yes, hypocalcemic tetany features of hypocalcemia like paresthesias, they can be seen in such cases where calcium is being utilized by the toxicological agent like ethylene glycol. Ethylene glycol is used in our vehicles. It is used as antifreeze in our vehicles. What is the shape of calcium oxalate crystals? Another question zone. So calcium oxalate crystals can be of two types. If they are bihydrate crystals, what is the shape of bihydrate crystals? Yes, bihydrate ones are envelope shape. These two lines of envelope to be remembered as bi. Then monohydrate crystals are dumbbell shape like this. The two ends of the dumbbell represent the two O's. So monohydrate crystals are dumbbell shape, bihydrate ones are envelope shape. Now coming to about the upcoming special classes. On coming Saturday and Sunday, that is 17th and 18th, I will have your image based MCQs on Unacademy platform in the form of special classes. So this is free special class for every student. And then on coming Tuesday, Saturday and Sunday, I will be planning more extra special classes to cover these type of MCQs for your upcoming CET exam. And few sessions will be there for upcoming FMG exams also. So everything will be scheduled by midnight, and I will let you know in the Telegram group. You will come to know about the enrollment links and about the date and timings. So this is about upcoming special classes, and the current plus courses which are already running are your NEET PG batch courses for your 21 exam, then NEET PG batch courses for 22 exam, as well as FMG batch courses for your exam on 4th of December. So these are the batch courses which are running. Then there are very concise courses of 1 month, like for FMGs. A 1 month course has been launched just in the October month, complete revision of 19 subjects in shorter duration, focusing towards the high yield topics. Okay. So see you all in special classes, upcoming special classes in the form of image based MCQs. Many new different images will be there which can come as probable questions, and the classes will be more on further Tuesday, Saturday and Sunday. I'll be planning classes by today. So time to say goodbye. So remember the referral code. You can use this referral code at the time of checkout to get a discount for any duration of subscription or for iconic subscription. This referral code will be valid. Okay, then bye bye. See you all in later sessions with some new questions like this. Stay safe, stay healthy. Always maintain your protection. Okay. Bye bye. Bye bye.